I'm Dr. Diane Marosy in Mena, Arkansas. I wanted to talk a little bit today about a common buzzword lately, sleep apnea, and so many people have CPAP machines, and so many don't even know what sleep apnea is. A lot of people snore, and their wives, typically it's men, although women are affected also. So often the women will say, well, my husband used to snore, but he doesn't snore anymore. Uh-oh. Good possibility, yeah, he used to snore, but now he's gone into full-blown sleep apnea. He doesn't snore because he's quit breathing. Sleep apnea it's kind of like if you have a balloon, it's filled with air, and you squeeze the top of it, and that it makes a sound. That's someone snoring. The airway is still partially open, but it's also partially blocked. It makes a noise as the air passes through. You squeeze it completely shut, that's sleep apnea. There's no air going in or out. Sleep apnea, to be diagnosed with sleep apnea, you have to stop breathing for at least 10 seconds or more before it's diagnosed as an apneic event. Well, you stop breathing if it's between 0 to 5 times a night. That's considered, in an hour, that's considered fairly normal. 5 to 15 is mild, 15 to 30 is moderate, and over 30 is severe. Some people stop breathing over 30 times an hour for at least 10 seconds each time. Now, mind you, some of these events, they can stop breathing for 20 seconds, 30 seconds. You try and just wide awake, try and hold your breath that long and see how hard it is on your body. It leads to high blood pressure, reflux disease, diabetes. There are so many, everything in the body is tied together. And if you stop breathing, that's the number one thing your body needs is oxygen. So your body's not getting the oxygen because you've stopped breathing. Your heart is going to start pumping that much harder and faster to try and get that oxygen throughout the body. And it just stresses your entire system, which affects your sleep. When you stop breathing, your body is going into almost like a crisis mode. I've got to get oxygen, and eventually it's going to wake you up. So you're going to breathe again. Your body is going to just all of a sudden send that signal, breathe. You wake up, you fall right back asleep again, but it disrupts your sleep pattern. Normally you go from a light sleep to early sleep to a deep sleep and then to a REM sleep. Well, the body heals itself in deep sleep. When you start or stop breathing, your body wakes up and you don't get that deep sleep or the REM sleep that you need to recuperate. So it goes right back to your body wakes you up, you gasp for breath, you go back again to light sleep and breaking into again to a more rested sleep. And that's, again, where you'll start seeing someone snore or stop breathing. So they never get enough of that deep recuperative sleep or the REM sleep. So it affects so much, and people get depressed. Well, why are you depressed? They don't realize it's because they're not getting that healing sleep. And how many people do you know that are on antidepressants, anti-anxiety meds, blood pressure meds, all these meds, and so much of it is tied into lack of sleep because they're not breathing. Now, years ago, CPAP was the only thing that was available. And that's changed in the last number of years, where if you're mild or moderate, a dental device is actually as effective as a CPAP. CPAP is still considered the gold standard, especially if the patient is severe. But if they're not severe, you don't have to have a CPAP. Or if you are severe, and won't wear a CPAP. So many people are not compliant with a CPAP because it's a hassle. You've got the machine, you've got the hoses, and oh, I do a lot of traveling. Who wants to carry all that stuff around with them? Well, you got better than 50% of patients are not really compliant with a CPAP. Well, in my mind, although they do need a CPAP, if they're not going to wear it, a dental device is better than nothing. And when you're talking about throwing something like this in a suitcase versus an entire machine and hoses, this is nothing to throw in a suitcase. So it's been proven efficacious, and this is what we do, preferably for those that are mild or moderate. We prescribe an oral device. Probably two of the biggest concerns that people have when they're considering a dental appointment, or fear of pain or the expense involved. The nice thing about sleep apnea, one of the reasons I adore treating sleep apnea, is there's no pain involved. Any testing we do is pain-free, it's painless, it's easy, it's quick. The device itself is painless. And as far as the expense, this is a procedure that is covered by the majority of insurance companies. So if you have any questions, we'd love to hear from you. If you want to call, we can find out if you are qualified for this as a benefit through your insurance. Just let us know. We'll put the smile back on your face.